Good evening, ladies and gentlemen. Welcome to Applied Near Life. I also call it Team Training Tuesday, to which you are most welcome to invite guests so that they learn what we have and what we do and what we are all about in this family that we like to call the family on a mission to make the world healthier and happier. My name is Eseza Nambasi. I'm a medical doctor by training and by passion. I love what we do in near life. And today I'm just urging us to be interested, just to get interested so that you can become more willing to take greater care of your health and the health of your loved ones. So today we are discussing a long topic, a topic called thrombophlebitis. And just to break it down, a thrombus is a clot. Then phlebitis is inflammation inside veins. So thrombophlebitis is clot formation inside veins following inflammation within the veins. Now, let's have a look at a few definitions and scenarios. A superficial thrombophlebitis, which means a shallow type. It is relatively common where veins feel harder than normal. They appear red or dark and they are associated with pain and swelling. It can happen in the legs or elsewhere. And this can spread to affect the lymphatics. Whereas um, if we look at the causes, it can be due to trauma, it can be due to infection from, for example, an intravenous injection, an injection given in the vein. It can be from standing for a long time and lacking exercise. It can also be as a result of smoking. The inflammation in the vein can be due to smoking for a long time. Or it could be due to obesity. Overweight and obesity can result in superficial thrombophlebitis. So it looks something like that. If you see the shallow veins and there are areas of inflammation, okay, and that can get a blood clot to start forming. On the other hand, deep vein thrombosis is in the deeper veins. They might not be visible, but that's what we wanted to contrast. So now let's talk about deep thrombophlebitis. It is often referred to as deep vein thrombosis. It affects veins that are inside or in between muscles. So inter and intramuscular veins, which are large. It is serious as these veins carry a large volume of blood back to the heart. So it has to be taken seriously. The risk of a deep vein, deep thrombophlebitis, the risk of that is that it results in chronically reduced blood flow, which ends up causing dark pigmentation. It can cause dermatitis. In other words, the skin becomes inflamed, and then ulceration, what we sometimes call a venous ulcer. Now, varicose veins, these are uh, described as such. Valves in the veins become damaged, leading to accumulation of blood. And when that happens, there is low oxygen and nutrients in the affected limb. Inflammation results, which manifests as pain, swelling, and potential for infection as well. Let me just look at this. Sorry. Um, okay. The potential for infection can result. Um, and then the significance of this is that this can lead to formation of deadly clots that we call thromboemboli. In other words, the clot shifts from where it has formed and can travel around the body. It's extremely important that the muscle pump mechanism works efficiently and valves in the veins work well. But we see quite a lot of varicose veins, which means that the valves are not working and the muscles are not pumping the blood. So this is something to show varicose veins when the veins accumulate blood because of the faulty muscle and the faulty valves within the veins. Right. So varicose veins, what actually leads to damage of valves? So I thought we should discuss this. One thing is constipation. If one is constantly constipated, that can lead to damage to the valves. And then increased intra-abdominal pressure, such as during pregnancy, in the abdomen. Then lack of exercise, because one has to have functioning muscles which are of a good tone. So poor muscle tone. And then weakness of legs due to vitamin B1 and vitamin D deficiencies. And these are very common. Both D and B1 are common deficiencies. Now, there's a note here that beriberi, that's a disease that is as a result of thiamine or vitamin B1 deficiency, is also associated with heart failure, which to me tells me that the valves of the heart are affected if these deficiencies happen. And then the muscle tone, that's what we are discussing as well, is also affected. Now, this disease that we call beriberi or vitamin B1 deficiency became very common and very prevalent when polishing of grain, particularly rice, became popular. Now, we know that rice is a very popular food. It's eaten widely around the world, and food processing led to the polishing, whereby a lot of vitamins and other nutrients are lost. Vitamins, minerals, and of course the grain oils. So now, this is a picture just to show you what a leg with poor circulation due to damaged valves in the veins can look like. And let us look at the 8 early warning signs of a blood clot that should never be ignored. So this is actually quite serious. We see people like this, and then they might not take it seriously. We can't take it seriously for them. And then ultimately they end up losing a leg. So 8 signs to take seriously. Swelling in one limb. If one limb gets swollen, that has to be taken seriously. Then pain and tenderness or cramps in the limbs. Red or dark streaks along the veins. Chest pain and heavy breathing might indicate that a clot has shifted and has gone to the lungs. Shortness of breath, unexplained cough, vomiting or diarrhea, and chronic headaches. All common symptoms, but now I'm just discussing this so that we always learn to ask ourselves, what else could it be? Now, how does all this begin in the first place? You know, minor injuries occurring repeatedly within the blood vessels can lead to this kind of cycle to be set up. The body's normal processes of repair take place. In other words, the platelets collect, a clot forms by circulating a certain protein called fibrinogen, also known as clotting factor 1. And then fibrin, which is insoluble, forms a net which traps blood cells and plasma. And there you have a clot. A clot has formed. Symptoms and signs: worse on walking, tends to ease off with rest and elevation of the limbs, swelling, warmth, dark discoloration, that seems to be quite a feature. And then somebody may develop fevers and uh, chills. So one has to have a high index of suspicion because, you know, you might not even think about it, but if you have it in the back of your mind, and I guess that's a reason for presenting, especially because symptoms may be taken lightly by the person with the symptoms, okay? So let us always remember to ask about factors that may suggest increased risk, such as smoking, such as lack of exercise. So the biggest concern ends up to be the biggest threat when the clot breaks off and travels in the bloodstream and cuts off blood supply to various organs, important organs such as the heart, the brain, the lungs, the kidneys, the eyes, the gut, and of course the limbs. Now, factors that influence clot formation, and you might wonder why I'm showing peas in a pod. Abnormal clotting tendencies due to deficiencies or abnormalities in factors required may be what cause this challenge of clot formation. Now, what happens is that the body needs coagulation factors, it needs calcium, it needs phospholipids, and if those are all there and yet the liver is not functioning very well, for example, because the liver must be able to use the vitamin K to produce the right coagulation factors in the right ratio and as well as to be able to break them down. Now, vitamin K is from plant sources, and that's why I'm showing you these peas and the green pods. And it is also found in some animal sources. And if the gut is functioning very well, gut bacteria, the normal gut bacteria that we're supposed to have, make some vitamin K. Then the balance of clotting and breaking down of clots can function well. So I want us to think about a few things. And these are the sort of random thoughts. Straining when passing stool increases the pressure in the rectal and anal veins by over 2 times the normal. And then weakening of the blood vessels, leading to damaging of the valves within the veins. And this can cause or aggravate hemorrhoids or piles, which are actually engorged veins. And there, if there is inflammation in those hemorrhoids or the piles in the veins, it forms a seed or a nidus of the thrombus to form. So we need to really connect these dots. One of my favorite pastimes, and I am also speaking not only to you, but to myself. One has to be aware of these things. So now, because we're talking about veins, they are part of the cardiovascular system, the heart and blood vessel system. And cardiovascular disease is the leading health problem worldwide. Millions of people are afflicted. Many do not even know that they have cardiovascular disease because they might have no symptoms. And a stroke may be a common presentation of a cardiovascular disease. And when it does happen, it is actually a very serious situation because a lot of suffering happens as a result of stroke. So just note that thrombophlebitis is also associated with environmental sensitivities and allergies. I've just put that in there so that we can start connecting why in the family that we belong to emphasize certain things, such as uh, care of the environment to remove things that can cause sensitivities and allergies. But now I want to talk about the diet. It is so important, and I guess that's a big factor in the environment, what we eat. Because it is important to know that you are what you eat. And the reality is that 75% of all chronic diseases, including cardiovascular disease, and in the case that we're discussing now, thrombophlebitis, can be prevented. It's totally preventable. So I'd like to introduce you to what we have in this family, and I'd like to start with the Scientific Advisory Board, who have researched and developed all the products that we have and present them to us, starting with the foundational product that we call TreeNN. Once TreeNN is on board, you can be sure that you are going a long way to enhancing your health and avoiding formation of clots in the veins. Because TreeNN have noticed that constipation is dealt with quite effectively. So feel your best with TreeNN. We've started there, but it is important to remember overall lifestyle choices. And we've mentioned them: exercise, making sure that you eat healthy food, get sunshine so that your skin can create that vitamin D that one needs, and fresh air to avoid those environmental toxins that can lead to allergies, adequate rest, and other things like weight management, physical activity, and making sure your diet supplies what your body needs. So let's talk about some supplements. And it is important that we need supplements. And as I've been talking about thrombophlebitis, and I've said that the veins have valves, and the way the blood is encouraged to go back towards the heart in the veins is by muscle activity. Now, as we grow older, unfortunately, our muscles become flabby. They become unable to work well. And so that is the first thing I want to talk about. To mention that we have products that supply us with the nutrients that will feed those muscles so that as one grows older, you can avoid developing a condition that we call sarcopenia, which means loss of muscle mass. Because if the muscle mass is lost, then the tone of those muscles cannot pump blood back adequately, and the chances of developing damage to the valves become even higher. So I'm just going to show you supplements and why we need supplements, why we need to supplement. I've talked about TreeNN because with the right nutrition, your cells can perform their very best. Let's talk about TreeNN within Pro Vitality. This is a picture of Pro Vitality, which gives us omega-3. This is a very powerful anti-inflammatory. Remember, we said that inflammation can cause the beginning of a clot to form. And then we have fruits and vegetable extracts in carotenoid complex, which work to protect the cells and also to protect these oils that you are giving. We call them essential fatty acids. They need to be protected so that they don't become damaging instead. And then, of course, we have vitamins and minerals. Now, the targeted solutions. Always we start with the core nutrition, which I've shown you. The Pro Vitality, or at the very least, 3NN. And then a very important part of the core nutrition are the 22 amino acids that are found in the Your Life Shake. Now, if you add the targeted solutions, we can talk about avoiding constipation. And here are some products that you can consider. If you feel that your diet doesn't have enough fiber, a lot of traditional diets have a lot of fiber. And so that was never a concern until we began eating too much bread, too much meat. Meat has very little fiber. And having processed foods, that all this problem of constipation began to feature, to become a challenge. So we have fiber. We also have aloe vera, which has been shown to help with digestive comfort because, again, once the body is incapable in the gut of making adequate amounts of the smooth mucus to allow the stool to be evacuated properly, then constipation becomes a vicious cycle, and aloe vera has been shown to help. So those are just some suggestions. And then I wanted to show this picture. I know Acidophilus has not quite been on the market for several months, but garlic, stage 6, beta guard, form the cleanse part of the detox. And then after that, you replenish good bacteria after you've cleansed. It's important to do that regularly so that constipation is taken care of or eliminated. And then other things like minerals. Yes, you know, it might be a case of the muscles and the nerves within the gut and other parts of the body, muscles all over the body, that need to be encouraged and enhanced in their function. So calcium and magnesium is very important. These two minerals work together for them to be really effective. Apart from helping with bones and teeth and all that, they also help with the stress. And we all know that when we tend to be stressed, we can also become quite constipated. And then we mentioned vitamin D. We have two types. We have vitamin D in other products as well, but vegan D is important. And vitamin A and D is also an excellent product. Blood doesn't stand and damage the valves, cause inflammation within. Right. Then, crucial for healthy blood vessels, you need vitamin C because it is important as an antioxidant, but it also tissue and to repair wounds and injuries and to build collagen tissue that helps to keep all tissues intact or strong. And yeah, so vitamin C is important. If you add and pair it with flavonoid, you'd be doing yourself a big favor because flavonoid enhances the function of vitamin C by 400%, which is quite phenomenal. Yes, and then garlic has another role. It helps with blood flow to keep the blood flowing well, as does vitamin E. And we all can safely say that prevention is always better. So let us get into that prevention mode because cardiovascular disease is not an inevitable result of aging. You know, you can look after your veins and arteries and the whole body well. Controllable factors causing lifestyle diseases include smoking, so avoid them. Smoking, stress, a sedentary lifestyle, dietary habits such as eating too many processed foods, then elevated unhealthy cholesterol, the inflammatory types of cholesterol instead of the good type of cholesterol, such as what we have in omega-3. And then weight management, because obesity can lead to what we are talking about, thrombophlebitis, and then diabetes. High blood sugar in its own right is inflammatory, and if there is a yo-yo or rise and fall and unstable blood sugar, there will also be instability in insulin as the body tries to deal with this sugar, and that in itself is quite inflaming. So when you see people who are sick and tired, and maybe it could be you yourself, anybody can be sick and tired of being sick and tired. Ask yourself, is there something happening with the cardiovascular system? And perhaps could it be the veins even? Yes. So let us become more responsible. We have a lot of products, but we also have a lot of information. Let's use that information to become healthier. And what I love about our family and opportunity is we have products for children to ensure that they start early, because that is the only way we can build a strong foundation for them. So these are the children's products. And then that thrombophlebitis and varicose veins are associated with environmental toxins and allergies. So we have a non-toxic cleaning range. You know, a lot of people consider this at the very least at the end or not at all. Please learn to use these products because they work well and they're very, very economical. They're very effective, very, very economical. You will save so much money that you will afford to use the other supplements that we've talked about. And of course, the laundry compound is non-toxic. And by eliminating those toxins, you can stop the danger of thrombophlebitis. What you use on your skin as well is important. So all these products are important and are given to us. Let's just use them. So to the guests, if there are any guests here, welcome. Good to have you here. You are most welcome to see how your health can be viewed with a long-range vision. That's what we have as one of our values, to do whatever we do with the long-range vision in mind. You can run your own nutrition business and discover a lot of possibilities. Thank you so much. I'm going to stop the recording and we can have a discussion. You're welcome to make any comments or contributions.